So in lab, you should be identifying your different vertebrae, which is going to include 3 major regions: the cervical region, aka the neck, the thoracic region, aka the chest, and then the lumbar region, aka the lower back. And in total, we do have 24 total vertebrae, 7 cervical, 12 thoracic, 5 lumbar. And there's an easy way to remember this. You have breakfast at 7, you have lunch at 12, you have an early dinner at 5. And then, after this lumbar, you have your sacrum. You only have one of those. And so you can say you have a late night snack at 1 a.m. So I wanted to share with you some interesting bits about our vertebral column and some disorders of the vertebral column. So I'm going to draw what your typical vertebral column curvature looks like. So here we would have our cervical, here we would have our thoracic, here we have our lumbar, here we have our sacral. Our thoracic and our sacral are considered primary curves because, as you know, the fetal position, this is supposed to be a head, you come out looking like a C, right? Like a little baby is all curled up like that. And so these curvatures of the thoracic vertebrae and the sacral vertebrae follow that initial primary curvature. Whereas the secondary curvatures of the cervical and lumbar regions, those are learned. I believe around 3 to 4 months, probably more around 4 months, a baby can start to hold its head up. And around 6 months, 6+ months, a baby can start to sit up, which means it's developing its lumbar curve. As we get older, your curvature kind of goes back to that primary C curve again. If you look at, an 85-year-old or 90-year-old, their back begins to lose bone density and muscle, so it kind of reverts to that primary curvature. But we're going to talk about a couple instances of curves where it doesn't necessarily go as it should. First off, we have scoliosis. And so typically with our vertebrae, it should follow a sagittal plane. But when an individual has scoliosis, notice it tends to fall laterally. And so it's going to the side like that. This is more common in females, and it develops in adolescence, so perhaps you had to go to school and they checked your back. They checked actually looking at the spinous processes of your vertebrae to see whether you had this lateral curve. So scoliosis is definitely an abnormal curve. It's pretty common. One sign of it is notice that the head of the shoulder, one head of the shoulder is lower than the other. They should be on the same plane. And then we have hyperlordosis and hyperkyphosis. Hyperlordosis is that hyper secondary curve, particularly of the lumbar vertebrae. And so you see this in pregnant women. And then hyperkyphosis is that hyper primary curvature. particularly in the thoracic spine. So, if you know, like the Hunchback of Notre Dame, he had hyperkyphosis. So here are two pelvises, os coxa. You got two os coxa bones joined together by the pubic symphysis with the sacrum in the middle. Which one of these is female? Perhaps you guessed that B is female, and that is correct. B is female, whereas A is male. So how can we tell? First off, you have this angle right here, and perhaps you notice for the female it's wider. This is called the pubic angle. These are the pubis bones, so the pubis bones make the pubic angle. For males, it's about 90 degrees or less. For females, it's wider than 90 degrees. So that's one example. Another is that this pelvic outlet is narrower for males. It tends to look more heart-shaped, and females tend to look more oval. So the pelvic outlet is narrower. And then I know you haven't learned these structures yet, but where you put your hands on your hips, right here, for males, it tends to be more superior, and for females, it tends to be more lateral. So here we have a female. Notice the very wide pubic angle. It's definitely over 90 degrees. That very wide pelvic outlet. And then notice the ilium, the iliac crests, are very lateral. They're not so superior as the males were. So we can tell the difference between males and females. Another difference is actually the coccyx. The coccyx is longer in males.